Great song there from an artist. They're from Congo. The song is titled Roho Hoabwana, playing right here on Hope FM. Listen and leave. It is now 23 minutes to 8 o'clock. Thank you for joining us on this Thursday's edition of the program, where we highlight the health of our bones every fourth Thursday of the month, and this happens to be one as we begin this new year. And so tonight I have the honor and privilege of hosting doctors. I have been surprised, and I say it's a pleasant surprise in a new year to be able to receive these wonderful doctors with me. I'm talking about Dr. Federico Sibona as well as Dr. Philemon Nyambati, all from AIC Cure International. So first and foremost, we get to find out how they're faring on, and then from then on we will unleash our topic of the day. So welcome, Dr. Harry. How have you been?
Thank you so much. We've been good. Mm-hmm. It was a good start of the year, and we are happy to be here again discussing for more different topics in this new year. Thank you for hosting us.
You're welcome. Dr. Nyambati, how have you been?
Well, I thank God for a new year, and so far so good. Thank you for having us.
You're welcome.
Yes.
All right. So onwards. Just to let you know, as you are viewing us on Hope FM Live on YouTube as well as on Facebook, you can share this with others. We can see your comments there as you share with us. And we also invite you to send your questions or comments on SMS line 20933, on WhatsApp 0717400555. And so tonight we want to understand, is it a condition or what? Yeah, we'll understand if it's a condition or what they call it. Whiplash, and get to have an inner discussion on the same, as well as get to know how somebody can be able to be diagnosed from the same and the treatment that comes with it. And so we'll start with Dr. Harry. I hope I pronounced it right. At times I look at these conditions and all that, and I ask myself, did I pronounce it right? So is it whiplash, or there is another name to it?
It is whiplash injury. So the cause of whiplash injury most of the time is a sudden force that is applied to the neck. So this happens most frequently when you are in a car and you are hit from the back, or there's a sudden deceleration of the car. So this causes a sudden hyperflexion and hyperextension of the neck, which means that you bend forward and backward the neck. And the faster that you're going, or the faster is the impact, the most common, the long-term complications could be. So there's different degrees of a whiplash injury. So depending on that, on the signs and the symptoms of the patient, you have to evaluate how serious it is, the injury. And back home in Europe, at least, it's one of the most common causes of persistent symptoms, I would say, disability because of persistent pain and loss of days of jobs because of persistent issues. And sometimes it's quite difficult to determine how hard was the impact and how the symptoms are, because also compensation related things, because sometimes the impact is not really much, but there's a lot of things going on with insurance that make people over react to symptoms and stay at home too much from the job, especially if people are not happy from their job. But and sometimes it's really difficult to assess the disability caused by the injury, and most of the time people undergo advanced imaging if they have persistent pain. So there's a Canadian association that developed a score to understand if an X-ray is necessary or not, to decrease almost to 42% the rate of X-rays that is needed in these cases. But most of the time, X-rays asked for everyone when the first assessment has been done, despite the symptoms, not unless the patient comes and has no symptoms at all. So basically, the injury is caused by a sudden acceleration and deceleration that makes our neck to bend forward and backward in a hyper flexed or hyper extended position. So we can talk also later on about how can we prevent these injuries in case it is going to happen in the future, because it's something that you cannot prevent, and most of the time you don't have the time to react to the impact. So that's why the injuries sometimes can be very serious, because people were not ready for an impact, because usually it happens suddenly without the person not knowing about it. So it can be quite of an injury in case of high speed injury.
Dr. Nyambat, you'd like to add on that, because I'm establishing now it's mostly caused by what you'd call car accidents or sports injuries. So you can add something on that so that we can get a better understanding of this.
Okay, good. So with me, we came with a spine model. So usually the neck bones are about 7 cervical vertebrae that attach all the way to the head. And so, as what he was talking about, rapid acceleration where you're hit from behind. So what happens is that the neck goes to an excessive extension. So once it goes that way, then there's a rapid stop, and so then it goes now into excessive flexion. So that's what actually happens. And so with that, there are a number of muscles and nerves, the bones themselves, and even the head itself, because you're hit from behind. So the head goes behind, then you come forward, you can hit the steering wheel, you can hit based on how the cassette is. So you hit from behind, then you go in front. And so what happens is that because of that injury, what Dr. Federico has talked about causes a lot of pain. There's the most common is actually accidents, rear accidents, where you're hit from behind, sports injuries, especially like rugby or American football for some. And also even in when you're going in the, what is it called? Not escalator, roller coaster. Roller coaster. So that the rapid acceleration, deceleration also can cause the same, and mainly happens also it can be in the young people, contact sports, contact injury, and also in older people like the females, because the neck is not as long, and also they are older, so they're more prone to injury, and so the risk is being having that rapid acceleration, deceleration. Yes.
So what would you say are the typical symptoms? Somebody comes to your practice and they portray some certain symptoms. What would you look out for?
Okay. So yes, as Dr. Federico had talked about, there are various grades, but the most common symptoms that present because of that rapid injury, one is excessive pain, because either the muscles could get injured, the bone can get injured, or because of the rapid movement, a disc which is on one of the bones of the vertebra can go and impinge or press on one side of the nerve. So someone can present with excessive severe neck pain, in that they don't want to be touched at that area. And then the other one is that they can have, because of if they've hit anything, there's a risk of having headache, because probably they have hit the steering wheel, because as the neck moves, also the head moves. So they're hit from behind. So the force takes the brain behind. Then when they go forward, the brain comes and hits the skull from in front. And so they can have severe headache, vision problems, or some temporary loss of consciousness where they're not able to feel. But now coming to the whiplash itself, they can have numbness that goes to the back, going down the back or on the hand. The other aspect also is that they have pain on trying to turn, that they cannot turn, and they have excessive stiffness. Yes, so those are the things that tend to happen in terms of, that's what the patient will complain of, that they're feeling tingling on the hands, they're feeling pain that they cannot turn, or even when being touched at that point, they feel pain. And then the other part also is that they can, now the higher the grade, that they can have even paralysis, where now they cannot completely move the hand. So they can either have weakness to paralysis where they're not able, if the injury is very severe. Yes.
All right. Let's now go to the treatment option, diagnosis and treatment option. I know Dr. Federico had alluded to the fact that there could be X-ray and all that.
Yes.
So you could take us through the diagnosis and treatment, how Whiplash is diagnosed, and then the treatment options available.
So the first step is to be carefully evaluated if there's any sign of tingling, excessive pain, stiffness, and then when the pain is located in the center of the neck, that means that something in the spine might have happened. And sometimes, especially in children, there's lesions that are not seen by plain radiographs. So in children, the evaluation is even more difficult because you can't tell just by the plain X-ray. So it's more of a clinical diagnosis. So most of the time, it is to put either a soft collar if there's no evidence of a fracture, and then give anti-inflammatory drugs like brufen, or painkillers like paracetamol, and then sometimes also we give muscle relaxant that they have two objectives. One is to avoid, because usually after the trauma, in the first 12 hours the pain is increasing and the muscle stiffness is increasing. So you want to decrease the muscle stiffness because usually patients are complaining also of lack of sleep. Sleeping is quite difficult. So muscle relaxants have two reasons. One is to relax the muscle, as said, but the other is most of those muscle relaxants, if taken before going to sleep, they make sleeping easier because they cause people to fall asleep more easily. So it's a double reason for the treatment with muscle relaxant, which usually for other conditions, especially if the patient has to go to work, you don't want to give too much muscle relaxant because they will feel sleepy during the day. But in this case, especially in the acute period, you want the patient to sleep easily rather than having difficulty in sleep, especially if in the first few days the patient is been not going to work for the first days. Then there's a series of evaluation that you have to make in the next day too, because suppose there's no fracture, so the symptoms should be getting better and better, but most of the time, so there's an evaluation that at 7 days, where usually for very mild injuries you remove the soft collar, the patient is much better, and they can resume the work. But sometimes the pain is still there, so you start active physiotherapy to elicit the range of motion of the neck if there's no sign of paralysis or tingling in the upper extremities. And you have to test the reflexes that can tell you indirectly if there's a nerve damage or not. And then there's further evaluations at 3 weeks, 6 weeks, and 12 weeks. By 12 weeks, more than 40% should not have pain in general. But 60%, despite the injury is not bad, can still have pain. So sometimes it's an organic pain due to a lesion that is not really visible on the plain films, because it might be a ligamentous injury that eventually will recover. But other times it gives like permanent pain that it's difficult to understand, and these whiplash injuries are also described a lot in the literature of psychology and psychiatry, because they can trigger like chronic pain that needs to be treated not just medically but also psychologically, because it could be like a permanent lesion that is not detectable, but it needs to have also psychological support to help when. But this is a diagnostic of exclusion, we say, which means that you've done all the tests that you would have needed to be done. Because if the pain persists, let's say after the first week and then the third week, you still have a lot of pain, then an MRI, which is advanced imaging, is needed to understand if there's an injury that cannot be caught by the X-ray. Despite the patient has no neurologic involvement, it might be a lesion that needs an immobilization for longer time, up to 6 weeks of neck collar, and sometimes you have to use a rigid neck collar because you don't want the patient to move too much, because it might subsequently develop a worse injury if he keeps moving his neck. So most of the time, fortunately, those lesions are benign, I would say, so that with a soft collar, anti-inflammatory drugs, muscle relaxant, and painkillers are doing well. And the pain, you expect the pain to be completely resolved within 1 to 3 months. Some of them are bad injuries that, especially if there's a nerve palsy, they need to be treated surgically to stabilize the spine, to avoid a worse nerve damage. Or suppose in between the vertebrae that we have those cushions called discs. Okay, so those discs are helping the vertebrae, the spine, to be more flexible. Because if we would have put just bones, it would be a rigid system without motion. Okay, because if you think about all the movement that the neck can do, it's almost a 360 movement. It's not just flexion, extension, and lateral deviation. There's also rotation. So there's a lot of movement that the neck can do. So if there's one of these discs, one of these small cushions that is in between the vertebrae, goes backwards, that can cause damage to the nerves that are behind the bones. And then what happens is that it can cause a palsy. Like, you won't feel your arm. If it's central, you might not feel both arms and legs being on the cervical spine, which is the neck. Or if it's on one side, it can be a palsy just on one side, because the nerve, basically, this cushion takes the space of the nerve. Now the nerve is kind of collapsed, so you need to remove that disc that has protruded posteriorly, where the nerves are passing by, and by removing that part of the cushion that has been gone to the nerve, to compress the nerve root. Now, if it's done within the right amount of time, the patient can slowly recover from the palsy. So that is, though sometimes, depending on the gravity of the trauma, especially the issues when we have a patient that is not conscious, so those are usually undergoing a total spine CT scan, at least to see any bony injury, so that you can operate acutely even if the patient is not conscious, because he cannot tell you the symptoms, and it's hard to elicit any movement if the patient is unconscious. So those are the most tricky cases. But if the patient is conscious, then we can ask all these questions and see what is moving, what is not, what has which part of the body has tingling sensation. So that's more easier to get a diagnosis, so to get a better treatment. And as we were talking about preventive measures, so it's very important to have the seatbelt, because nowadays, with the advent of airbags, especially if you don't have a seatbelt, you can have almost a burn injury if because the airbag deploys, right? So it's a small explosion, let's say. So if you don't have the belt, your head is going to go too fast against the airbag, and it can give even a worse injury. So having a car with airbag without putting the belt is completely useless, because the damage that you can cause to yourself, it's quite bad. It's worse than without the airbag. So the most important thing is to keep the seat upright, so that when you're sitting, you are against the headrest, so that there's less risk of this lesion in bending up forward and backward, because on your back there is the headrest, and the airbag protects against this forward flexion in conjunction with the seatbelt. So all these things that are in the car must be used, especially if you have kids. Always put the belt. I know that some car right now, or the newest one, they all have that system that beeps. But human being think always to be either wiser or smarter than the car, so they put the seatbelt behind, and then they lock it behind the back. Or in Italy, they even have this fake system just to lock it into the belt. Without the belt itself, so that you lock that part, so that the belt is not beeping, so that is not bothering when you're driving. But that increases the risk of trauma, because we never think about it. But when it happens, if we have used all the preventive measures, there's much less likelihood of having a permanent injury. I think our scope here is not just to say about those injuries, but the most important thing in these things is prevention. So if your car has airbag and seatbelt, be sure that they can be used in case of impact, because it's once in a lifetime. You never think about it, especially when you're healthy and young, but it's just one episode that can change your life forever. And so you should do everything to love yourself and to protect yourself, using the preventive measures that the cars have. So use the seatbelt, put the seat upright, so that the headrest can be close to the head when you're driving. So there's, in case of any accident, there's less risk of a bad injury.
All right. Thank you, Dr. Federico. We'll continue in the next hour with more of this insights regarding whiplash injuries. And we also have Dr. Philemon Nyambati in studio to be able to look at this. We invite you to send your questions or your comments to our SMS line 20933 on WhatsApp 0717 400 555.
Breath of heaven, breath of heaven.
Glorious, beautiful, with your strength and might and power.
Settle down to a night in God's presence. Settle down to a night in God's presence with the most awesome praise and worship music.
Listen and live on 93.3 FM in Nairobi, 93.9 Western Kenya, and 101.9 Mombasa.
Hope FM. It's now 8 p.m.
Listen and live.
A revival is breaking out.
The voice of hope in the air.
Hope FM, listen and live.
Hey, it's all too easy to fool ourselves into thinking that we're rather more important in this world than we actually are. That our services are in high demand. That busy is just how life's meant to be lived. Hi, I'm Bernie Diamond, and welcome again to Fresh. Of course, we go through stages when there's no getting around the fact that the time we have available isn't enough to do all that needs to be done. Any working parent with children can tell you that. Someone working 3 jobs just to make ends meet can tell you that. But those are meant to be stages that we travel through, not permanent states that we live in. However high the demands on your time may be, can I say the worst thing you can possibly do is to convince yourself that you don't have time to pray, which, by the way, is the number one excuse for the poor prayer lives that so many people lead. It's difficult to imagine anyone who was more in demand than Jesus. Man, he had rock star status. Whole cities would empty out to go to listen to him in a field somewhere when he came to town. Such was his life. Mark chapter 1, verses 35 to 37. The next morning, Jesus woke up very early. He left the house while it was still dark and went to a place where he could be alone and pray. Later, Simon and his friends went to look for Jesus. They found him and said, "Everyone's looking for you." Despite that great demand, Jesus seemed always to be able to make time to pray, because that's where the power, the peace, the wisdom come from. Make the time to pray. That's God's word, fresh for you today. And there's such power in the word of God. That's why I'd love to share more of God's word with you. So let me encourage you to subscribe to our YouTube channel at ChristianityWorks.tv. The Word of God is alive and active. It is the power to transform your life. So again, you'll find our YouTube channel at ChristianityWorks.tv. Hey, may you be blessed as you receive His Word.
Rafiki soul is a promise of our hand that reaches and goes beyond. Watangaza tumaini kote. I'm forever grateful. Ninashukuru ukarimu, ukarimu. I'm forever grateful. Ninashukuru ukarimu, ukarimu. Rafiki msoul.
Thank you for being a friend of hope. To donate, kindly use the M-Pesa paybill number 933 933. Account FOH.
Welcome to the world of Hope Media, a media unit of Christ is the Answer Ministries that is committed to spreading the gospel of our Lord Jesus Christ through the transformative power of media. Hope Media is dedicated to utilizing various forms of media to spread the message of hope, love, and redemption to all people around the world. Hope Media consists of various units that work together to achieve this goal. These units include Hope FM. Hope FM is your #1 Christian radio station offering you discussions on current day-to-day issues, inspiring music, life-changing sermons, and news updates, broadcasting 80% in English and 20% in Swahili, with listenership of over 12 million every month. Hope TV. Hope TV programming is designed to inspire, educate, and challenge the viewer with wholesome content to reach various demographic groups, children, youth, and adults, both male and female, with viewership of over 24 million every month. Hope Recording Studios. Hope Recording Studios is a state-of-the-art recording facility that offers high-quality recording, mixing, and mastering services. It is designed to meet the needs of musicians, artists, and other creative professionals who require top-notch recording facilities. Hope Creative. At Hope Creatives, we believe that inspiring graphic design work doesn't just happen. It takes the right people with wild out-of-the-box ideas committed to the same ideals, working together to make it happen. We listen, we learn, we brand. Hope Digital. Hope Digital is a creative digital unit within Hope Media. We are driven by a passion to creatively express ourselves while influencing you with the same creative energy in online spaces and beyond. At Hope Media, we believe that media can be a powerful tool for spreading the message of hope as well as grow your business through advertisements, and we do this with excellence. For more information regarding our services, please visit www.hopemediakenya.org or call us on 0709 861 180. Hope Media. We keep hope alive.
Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends?
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I broke my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah. I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I broke my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah. I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
Great music there from MOG Music, and the song is titled Living God. He's our Artist of the Week here on Breath of Heaven, and in addition to his music career, MOG Music is a dedicated philanthropist actively involved in community outreach and initiatives aimed at supporting the less fortunate. His commitment to his faith and community continues to influence his work and inspire many as he continues to create music that touches hearts and transforms lives. MOG Music remains a beloved figure in Ghana and beyond, spreading the message of love and hope through his art. Welcome to the second hour of Breath of Heaven, and we are all about the health of our bones this night, talking about injuries known as whiplash. And with me in studio, I have two doctors. I have Dr. Philemon Nyambati and Dr. Federico Sibona, who are from AIC International, helping us demystify whiplash injuries and what we can do. And so in the previous hour, I know we have talked about the diagnosis and as well as what one would look out as the symptoms and what whiplash is all about. And so in this hour, I'd like us to touch on long-term effects as well as management as we carry on. There are more things that you would want us to know about it. And so I'll start with Dr. Philemon. You will share with us some of the long-term effects and management. Are there any long-term effects of whiplash that patients should be aware of? You can talk about that.
So long-term one is first it depends on the severity of the injury. So one is if the injury is more severe, there's more risk of more muscle injury and also the bone itself and the disc, as Dr. Federico had earlier talked about. And so what they might have is pain on the neck itself, at the back of the neck or on the sides. And that is something that even with the treatment, at times it cannot resolve. And so what there needs to happen is actually first trying to get to the bottom of what could be causing this. Is there something that could be entrapped, like a disc? Another thing is if this injury is severe, one thing is that they might have some tingling. Probably a disc could be compressing on one side or can happen in both arms. And that actually causes tingling or pins and needles because the disc is compressing on the nerve. And then also because of the pain that they could have, and if they do not do proper physiotherapy or rehab of the neck, they might have some stiffness, so the neck does not move as easily. That's more common in older people because with time there tends to be arthritis that can happen on the neck, then the neck bones, or they call the cervical vertebra, and so they'll have more stiffness. The other thing that also you have to be worried about is that there can be other associated injuries. There's what is called concussion, where the head, because of that rapid acceleration, deceleration, there can be injury to the head. And so if that is not watched out for, they might have some headache that might be persistent, blood vision. And so as initially when the patient is being seen, they also have to make sure that there's no head injury that happens. So in long term, what we fear is the neck pain. They might have difficulty in turning, and also either weakness of the muscles or tingling that can be long term. So that's one thing that you have to watch out for. But with that, if that happens, you have to have also further imaging. We talked about X-rays to check how the bones are. There's a CT scan that checks further how the bones are. There's what is called the MRI, because that now checks the muscles, the nerves, and the disc, if there's anything that's compressing on that surface, especially if you have tingling. So that is what will be able to locate where the disc is compressing that is causing either this tingling or this weakness. And so in terms of treatment, there's non-operative and there's operative treatment. So operative happens if this injury is severe, where there's a fracture, if part of the bone has broken and there's some weakness, so that you really need to intervene. But immediately, because most who present, they come with neck pain, they are assessed. Dr. Federico talked about diagnosis, but in terms of treatment, the thing that first there's a soft collar. If the injury is not severe, and there's a hard collar because the neck has been moved up and about, and so supporting the head, that can cause a lot of pain. So you may need some hard collar to actually maintain and prevent further injury. So for a period of about, it depends, it could be a short term of about 2 weeks to actually 6 weeks, max 12 weeks. you don't want to have it actually for very long, because the risk is the neck muscles can get weak, and so when you remove the can have pain because the neck is not able to support the head as well. And so with that also there's the medication. That's also treatment that my colleague has actually talked about, the non-steroidal and muscle relaxants. If there's any tingling, there's medication that can be given just to ease the pain. It's called gabapentin, or the things that just help relieve the nerve pain that is causing. And then after that, there's also now what is called a cold therapy, whereby a cold pack is actually put on the area once the acute part. It's called the cold, the acute, or the probably the first 2 weeks after you've immobilized and the pain is actually subsiding. There's what is called cold therapy, whereby the cold pack is applied on the back for a period of about 10 days. Actually, that happens also in the acute, immediately on injury. And then after that, give heat therapy. So that's another form of treatment. And then physiotherapy, where we try, especially if they have neck muscles, some gentle manipulation and massage just to help with the pain that they're having. But that happens once you have ruled out that there's no neurologic injury. Yes. Not really neurologic, but there's no that the acute phase of pain has actually reduced. And so what we're doing is to try to help the muscles recover. And also if there's any shoulder issues because of the pain, so there's shoulder exercises that actually shown, and also ultrasound therapy. That's also another form of treatment, and also some radio frequency that's put on the neck just to help with the muscle and the nerves. Yes.
So this is what a patient can do while at home, or he or she has to be in hospital?
They have to be in at least in a hospital setup. In terms of where then they come in the outpatient and they're able to be seen by a rehab specialist or a physiotherapist just to help with the pain. If they are in the out of danger, there are exercise programs that can be shown of what the patient can do to help strengthen the neck muscles, and also the upper arm if there's been weakness that has occurred and the person has been assessed and it's found that the person does not need surgery. So there are home exercise programs that can be given by the physician once they've been assessed and cleared. But in the initial part, they can have a collar and they go to see a physiotherapy at the hospital in the outpatient setting, where they're done the cold therapy, ultrasound therapy, and the other part, radio frequency ablation. Yes.
Dr. Federico, in addition to that, in terms of long-term, short-term management of whiplash injuries?
Yes. So there's an Australian team that has developed My Whiplash Navigator. That is a website that can be consulted for free, where there's it's also for physiotherapists mainly, because what happens is the doctor sees the patients maybe the first time and then the second time, and he clears them. So it has been shown that the patients at low risk of long-term complications, it should not be overemphasized, the treatment, because it has been shown that the more time we see the patient, the more worries the patients will have, and the less predictable the outcome will be. So if someone is a low risk of long-term complications, it is better not to follow up too much, because otherwise, if we are sure that there's no organic issue, which means if you're sure there's no lesions. But for the ones that have higher risk, suppose someone has already had a spine fracture. So those have higher risk of long-term complications. So this website helps also in terms of psychological long-term outcomes to be better, to feel better in the long term, because so the patient will see mostly a physiotherapy afterward, after the specialist, like either the neurosurgeon or the orthopedic surgeon, have excluded serious injuries. But I would say beware of chiropractors or manipulation, because sometimes they can exacerbate the symptoms instead of resolving them. Okay, and especially for those, especially for those ones that are doing forced manipulation, maybe it has already happened that someone that was not having neurological symptoms, now because of forceful manipulation, passive manipulation, it has been caused discarnation, which means that patient that would not have tingling but just pain, now after forced manipulation by the chiropractor or the physiotherapist, they develop neurogenic symptoms that must be treated surgically because of forceful manipulation. So the guidelines have underlined the role of active therapy, which means not just passive manipulation, but using yourself, your own muscles, to be moving yourself. So the physiotherapist can show the movement that are allowed or not allowed, and then the patient can replicate. So with this Whiplash Navigator, there are some basic psychological advices that are really helpful for the patients, and also for the physiotherapist to understand when to refer the patient back to the doctor, or to refer the patient to a clinical psychologist, because the post-traumatic disorder or the post-traumatic stress disorder is quite common after this kind of trauma. And I want to say that you shouldn't feel bad for that. It's not that you are developing a sort of a psychiatric issue. It's normal because of the trauma. Sometimes it can be very emotional, because if you see, sometimes the cars are crashed so badly that when you get out of the car, you will remember forever how your car was, and then in your mind, this accident comes back and once again in your dreams. So it's not bad in this situation if you feel that you're still feeling bad after months, to be followed up by a psychologist that can help to relieve the pain, not physically related, but related to the trauma that you had, and to overcome the long-term disability related to the stress, not necessarily the pain, but the stress that you have. So that could really help. I know that most of the time people are reluctant to follow these advices, because they would say, oh, sooner or later it's going to end. But don't feel bad if you need few sessions with a psychologist, especially if you have long-term symptoms after a whiplash injury, and the doctor and the physiotherapist have ruled out any fracture, ligamentous injuries, or like injuries that can cause long-term complications. So psychology in this case helps quite a lot after such trauma in the long-term outcome.
It's good you've mentioned that, because it's a traumatic experience a patient might have gone through, especially when it comes to car accidents. And we've also mentioned something to do with sports. Whenever somebody is involved in a certain sport, probably I'm looking at soccer or even rugby.
Yes.
Especially rugby. I
Yes.
think it's so intense, and somebody finds themselves in such a situation and they need such assistance. And so, Dr. Philemon Nyambati, I'd like to ask you, I know Dr. Federico had alluded to the fact that there are preventative measures that one needs to take, especially ensuring that you buckle up your seat belt and all. I don't know if we can highlight a bit on matters to do with the sportsmen and women who also undergo such kind of injuries, the whiplash injuries, if you can mention some, or what you would want us to know when it comes to preventive measures?
I think it's important to first have proper safety, proper tackling techniques in terms of when playing in sportsmanship. That's very important, and so that comes as a systemic effort whereby the team coach and the players are able to have proper contact training and also protective measures such as helmets. Yes, that's very important, especially in like in the American football. In rugby, somewhere helmets, not really, but it's actually most important is actually the proper technique, especially in terms of how you tackle the other opponent. Yes, and also having a system whereby there's safety that is really encouraged in terms of the sports. Yes.
All right. Any addition to that?
No, I think in sports it's much more difficult to have preventive measures.
Yes.
I would say that nowadays they work up also quite a lot on building up the neck muscles, like the sternocleidomastoid muscle or the scalene muscles that can help in. So if you have better muscles, there's less likelihood of injury. But that is not really giving you the 100% that you're not gonna have any injury. It can prevent on a certain on a certain way, and you see that all the professional players of rugby, they're quite big from the shoulders and up, because they build up a lot on the upper body. But when you have this kind of impact, it's impossible to, and there's nothing that you can, like an NFL, the football league, the American Football League, they wear helmets and they have like big protection on the shoulders. But but this is more for the concussion injury, the head injuries. For the neck injuries, there's not really much that can be done on the field. I would say when you are in a difficult situation, I would advise to let go rather than keep going, especially in rugby, where maybe you have the ball and you are in the middle of the game with so many people tackling you. I would rather say let it go. But those are situations that are really difficult to prevent. So I guess that in the sports it's much more difficult to have such preventive measures like you can have when you have a car accident, and Dr. Nyambati explained everything, because the helmet that they use in rugby, the soft helmet, it's more for the head concussion injury, because for the neck there's nothing much that can be used. There was developed a sort of airbag for the motorbikes that it's been deployed when you jump out of the motorbike when you have an accident, that acts like a backpack, and it deploys when you're like falling off the motorbikes, and it prevents the hyperextension injury, but is not being popularized so much. Because I think it's really hard to utilize, and it was not really. It was a good idea, I would say, but it didn't get any space much in the market.
All right. In case you're joining us right now, this is Hope FM, and you are on Breath of Heaven. Tonight we are talking about whiplash injuries, how they come about, and diagnosis, symptoms, as well as management in hospital as well as at home. We've also talked about the preventative measures that one needs to pay close attention to. And so as we also head to some of the questions that are coming through, I remind you, in case you have a question in this theme that we have today, the topic of the day, you can feel free to send your question to 20933 on SMS line, 20933 on WhatsApp 0717400555, and we'll be able to look at them. And Dr. I'll first of all look at some of the questions that have come through, and then towards the end, we'll just conclude by giving a summary what we've shared today. There is this one here. I think it's a bit of a question, probably not very well related with this, but has to do with bones, and says, I have a burning sensation on my upper part of the leg every morning, but once I am out of the bed, the pain disappears. What could be the cause, since I have done x-rays and it shows nothing? Probably, whom do I start with? I'll start with Dr. Nyambati. You've had a question from Martha. Her name is Martha, having this burning sensation upper part of the leg every morning, but once she's out of bed, the pain disappears. What could be the cause, since she's done x-rays but it shows nothing?
So when you have burning sensation on the upper part of the leg, there are a number of causes that can happen. It's difficult to tell, but based on her explanation, one could be probably pain that is radiating actually from the back, on the lower back. Because of that, there could be a disc that is compressing on one side and it's causing pain, and and that happens with position. It depends on the position in terms of the mattress that she's sleeping in. If it is not as firm, it could be bending forward, and so that, if there's any disc issue, that is one that could be causing burning sensation on the upper part of the leg. The other thing also is, if there's any, it's hard to, she didn't explain whether it was at the back or the front. Sometimes you can have where the nerve crosses and with the tendons, and that, based on the position, it can actually be compressed, and that can cause tingling. And then on standing up and walking, that can actually be relieved. And so that could be probably the major cause of the tingling sensation. There are other things that can happen also, but that's far off if there's any form of vitamin deficiency, but that tends to be prolonged. Based on how it looks, something more of mechanical. And so based on x-rays just illuminate, or they mainly show the detail of the bone. And so probably the best first will be to see orthopedic surgeon, and just to examine and see what specifically, is it the hip, is it the knee, is it the back? And so once you rule that out, because those are things that can cause tingling, once you rule out, because the hip, if there's a hip problem, it could be a sacroiliac joint problem, or it could be a back problem. And so once that has been ruled out, what is done is an MRI. So that shows further imaging that shows the soft tissues, shows the muscles, shows the nerves, and shows the disc. Probably there's a disc that is visualized that could be compressing. That is what is causing the pain. But the best first would be actually to see a medical professional and to do a proper history and a physical exam, so that it's good to get the appropriate imaging. Yes.
In addition, Dr. Federico, to that?
It's difficult to understand the question, because it could be the upper part of the leg or the upper part of the thigh. So if it's the upper part of the thigh, that the other cause that could be what is called meralgia paresthetica, which is a condition that can be caused sometimes when you put a belt and you tighten it too much. That compresses a nerve that crosses right there where you put the belt, and it's just a sensory nerve. It's not a motor nerve. So you have really a burning sensation on the upper part of the thigh. So if the leg in this question was the thigh, okay? So the other, that could be the reason, okay? That's quite common if it's not the back. Then if she is asking about the leg, which means the knee, just below the knee, there's another nerve that crosses there, the common peroneal nerve, that can give that sensation. Usually, though, the common peroneal nerve is also a motor nerve, which means that it gives also the movement to the foot to be able to dorsiflex, which means to pulling up the ankle. So to dorsiflex the ankle, which means to lift up the toes and the foot itself. So the first thing that we usually do when patients have this tingling sensation is to tap on it. It's called the Tinel sign. So which means that you tap on the nerve where the nerve is crossing, and that gives a sort of electric shock. So that means that the nerve is somehow compressed. So that if you tap, now the patient, this reproduces sometimes the symptoms of the patient, so that you know that that's the cause. So for those reasons, you need to kind of decompress surgically the nerve. It's quite rare to be like if you don't have a trauma. So most of the time, it can just subside on its own. Though in case if it's now related to the back, as Dr. Nyambati was saying, then you need further imaging as an MRI to see if there's any disc herniation. The cushions that we were talking about between the bones of the back that is compressed on that side, and that gives like this burning sensation. Another thing that could be, if it's the thigh, it's a beginning of hip arthritis that is not visible on the MRI, but gives a sort of inguinal symptoms, or also I'm talking about everything now because the question was a bit generic. It could be, if it's just let's say the upper part of the thigh, it could be a bursitis. Trochanteric bursitis is another thing that gives this sort of burning or pain, especially in the morning after you wake up, if you sleep on that side. The trochanter is the part of the femur that is close to the hip joint, and if you just press with your hand about the thigh on the, let's say, on the lateral side, you will feel a firm end at the beginning of the femoral bone, and that's the greater trochanter. That's where sometimes you can have this inflammation that can cause this burning sensation, especially in the morning. So with the explanation that we just gave now, we sort of gave all the causes that could be triggering this sort of pain. But of course, you need a consultation to understand better the issue. But most of the time, this burning sensation can be managed conservatively without any surgery, but a diagnosis must be done before giving the treatment.
All right, thank you, Dr. Federico. Another question is coming through, and this one is from a listener from Nakuru, brother Alan K. Wopi, and they say, good evening to you together with our guests tonight. Kindly ask them about the management of deferred pain that emanates from within the bone marrow, and probably highlight some of the therapy that will help to avert that. I'll take that again. Ask about the management of deferred pain that emanates from within the bone marrow, and probably highlight some of the therapy that will help to avert that. I'll start with Dr. Nyambati.
Deferred pain, probably it's referred pain. So referred pain is pain that is elicited in one place but referred or goes to another place. And so one is that was hard to determine where specifically in terms of the bone marrow. There are a number of things that can present with referred pain. One could be if one has a hip pain, so you can have referred pain to the knee. So you might feel pain actually to the knee. Another thing is if there's a disc problem, as you talked about, which can compress a nerve and can cause pain that can be referred either to the foot or to the leg itself. Within the bone marrow, there could be other things that could be causing pain. Probably bone infarcts, some bit of infarcts within the bone that can actually cause pain. Or if those injury that had happened previously, and that could actually cause pain. So the nature of the pain could be different. It could either be, I think he wasn't specific whether the person was actually on air, whether is it a burning pain? Is it a dull pain? Does the pain happen at night? Does the pain happen during the morning? Does it happen on activity? So those are the things that actually need to be gotten, and it would be good to at least get consult so that we're able to specify the pain. But those are examples of pain that can be deferred, or if there's pain from what is seals like the bone marrow. Yeah, but I think Federico, you can add what you think.
I would say that it's difficult to understand to such a question because it must be specified many more things to understand which was the question related to. So it's really hard to understand. I think if you could be more precise, then we can answer precisely. Thank you.
All right, moving on. There is another question here, probably somebody who had matters to do with the knees problems and all, saying having pains and weakness behind my legs, especially from knees downwards, and it started around the butt, then it spread all over. It's more severe right after waking up from sleep, and I'm actually limping because of the same. What can be the cause? Sometimes the tingling and pains come too on the legs. That's from Vero. Probably can highlight on that.
So,
Dr. Federico,
this is a more specific question that can be answered. So most likely the pain comes from the back. And if it's from the leg, it means that it comes from the lower back. But sometimes you can have this tingling sensation without back pain. So you have what is called radicular pain. It means that the nerves are radiating to the legs. Okay, and they have roots. So the nerve, as it goes down to the leg, can cause to the specific innervated area this kind of pain. If I can take the model, I can show it here. And actually, this is a nice model because it has really what you're telling right now. So if I can, I hope it can be shown like that. So these are the vertebrae. These are the vertebrae. Of the spine. This is called lumbar spine. So what has been shown here? It's an herniated disc. So those ones in brown are the discs, the cushions that we've been talking about, and the yellow parts are the nerves. Okay, so when we have one of these discs, one of these cushions that is herniating, it means that it's going out of its space. Now this orange bulge can compress the yellow part, which is the root. Okay, so if the bulge is on one side or the other, that causes pain on one leg. All right. So, but if the bulge is in between, like if it's central, let's say, then it can cause the symptoms on both legs, and then that could be the pain that our patient is experiencing. So usually the first step is to do spine, like lumbar spine x-rays. Sometimes also we ask for dynamic x-rays in maximum flexion and maximum extension, so bending forward and bending backward to see if there's any instability of the spine, if we can't see any fracture or previous trauma. And then but usually if you have tingling sensation, we ask for an MRI to see if there's any compression of these nerves that can cause such a condition, and it can be treated, especially if you see that your strength is not as much as it used to be. Please go to a spine surgeon, or it could be a neurosurgeon or an orthopedic surgeon that is expert on spine, to understand better the issue and to test for the tendon reflexes and the strength, and to get further imaging to be treated, because you cannot live with that. you have to treat it, because the longer you wait, the worse it can be, and the more complications it might have.
All right. Interesting. Any addition to that?
Actually, he's said
He has
everything.
exhausted.
Yes, thank you.
All right. And another question here, as we look at more questions, here is a question that says, my brother is below 30 years old. He has occupational knee pains. Do you have free consultations for people who can't afford the cost? And when do they happen? Probably.
So AIC Kyo International Children's Hospital of Kenya, we for us, we deal with children. Yes. So for an adult, I'll recommend there are a number of clinics that they can see in Nairobi. Yes, I do not have any other top, but there's Kijabe Clinic at Westlands, along Rafter Road, Azwa Towers. That's one where they can seek for consult. Yes, because they are an adult. Yeah, but occupational knee pain happens with depending on either the type of work that they did, that they walk up and down, or any injury that can happen, and that can actually cause pain. Yes, so an adult specialist will help. Yes.
All right. I think those are the questions that have come through regarding other bone issues. And so we'll do what you call a summary of what we've been discussing tonight, especially for someone who just found us talking about this and they want a bit of a summary on the same. And then we can go ahead and of course, sum it up and tell the listener where they can find you. And in case they have any inquiries, how they can get to you. So I'll invite Dr. Federico probably will give us a bit of a summary on what we've discussed tonight, and then we'll hand it over to Dr. Philemon to give us where you can be found.
Okay, so tonight we've been discussing about whiplash injury, which is one of the most common lesions caused by either a traumatic sport injury or a car accident. And I think especially in places where there's less rugby and American football is much less common in this in context. I would say in Kenya it is much more common after a car accident. So it's one of the major causes of permanent disability, which is not necessarily an organic disability, which means that there's no permanent lesion to the body, but it might cause a long-term stress disorder that can be treated, if appropriately treated at the beginning, with the advice of a surgeon first, for the assessment to see that there's no complications that need surgery or acute treatment, and then a physiotherapy assisted in some cases by a clinical psychologist that can help to reduce the post-traumatic stress caused by the trauma, to reduce the long-term complications. And as we underlined during this hour, is that is not bad to go to a psychologist. Don't feel bad about it, because it is a trauma when you have such a injury. So if the pain persists without any visible lesion, that might be caused by the trauma itself that you had that day that you had that accident. In fact, long-term complications in children that are playing rugby or American football are not really seen without an injury, but in adults that is quite frequent, because only 40% have complete resolution of the pain, let's say 40 to 50% in 2 to 3 months. There's another 50% to 60% that still has some form of pain that is not completely resolved after 2 to 3 months. And those are the ones that we need to tackle with active movement of assisted physiotherapy and psychological advice that we can help to have less post-traumatic stress disorder. So it is important to seek for medical attention at the beginning, and then do usually 3 or 4 consultations just to check that like 1 week, 3 weeks, 6 weeks, 12 weeks, that everything is getting better and the patient is doing fine. And there's different types of treatment, from soft collar, painkillers, anti-inflammatory drugs and muscle relaxant, to the worst case scenario, but those are usually big accident where patient need surgery. That's the minority of the cases. The most common causes of pain are related to the shoulders, to the neck, and to the upper extremities. And sometimes people need focused physiotherapy for also for dizziness, because there's that could be something that can persist after the trauma, that needs aggressive, specific physiotherapy to reduce the symptoms quite quickly. And also we need to follow up mostly until 3 months after the injury. That's the most common part. And you must seek for attention if you have persistent symptoms.
Mm-hmm. Thank you, Dr. Federico. And so, to Dr. Philemon Nyumbat, you can share with us where somebody can find AICQ International, or in case of any consultation that they need, because like one of the listeners there, where to find out where they can find you, and probably other recommendations as you had put it, or even a number of websites where they can follow.
So the contact we are at Kijabe, Kijabe Hospital. In Kijabe in Kiambu. So the contact is 0733 770 653. I'll repeat, 0733 770 653. So the opening hours clinic is Monday to Friday. It's from 8 to 4 p.m., 8 a.m. to 4 p.m. And we see children 0 to 18 years of age that have orthopedic deformities. Yes. So also the website is info at curekenya.org. Info at curekenya.org.
All right.
Yes.
Thank you. Thank you so much for coming through. It's been a joy hosting you tonight, and looking forward to learning more in the course of the year as we get to find out how we can ensure that our bones are healthy, and in case of any eventualities, what to do. All right. Any parting shot?
I know. Thank you so much for this hour that we've been together. Thank you so much for hosting us, and we give also this message. As Cure, we treat every child that has a form of orthopedic issue, no matter at what cost. So don't be afraid to come. And don't keep your children at home with any disability, because there's always some hope. We have also spiritual service, because most of the time there's not just the physical trauma, the psychological and spiritual trauma, and we have mobile clinics all over the country. You can refer to the number that Dr. Nyambati gave to see which clinic is is the nearest to you to be seen in that clinic and seek for help, because nobody should be left out, and there's always hope for children, especially children with the disability, which we say is a different ability.
Thank you so much. Have yourself a blessed night. Hope to see you next time. We'll be having these wonderful conversations, helping us to know more about the health of our bones. And in the next hour, we have from the scriptures as well as reflections and prayer focus right here on Breath of Heaven.
Settle down to a night in God's presence.